Okay, our next talk is from Antoniou, investigation of the citrullination pathway and the pathogenesis of fibrotic lung disorders. Good job.
Okay, so good afternoon, and I would like to thank for this invitation. It's a pleasure to be in Modena. It's always a pleasure to be in Italy. And thank you, the organizers, and Professor Luca Richeldi for this invitation to present a collaboration study between Heraklion, the University of Crete, and the Royal Brompton Hospital. So I'll present this data on behalf of this group, and I thank them all for collaborating in this study. So I will try in the next few minutes to sharing with you our pathogenetic thoughts about the concept of autoimmunity in idiopathic pulmonary fibrosis. And I will let you know why we have chosen the citrullination pathway in order to investigate that, and to compare and contrast idiopathic pulmonary fibrosis with rheumatoid arthritis lung, fibrotic rheumatoid arthritis lung. So as you know, rheumatoid arthritis clinically has a significant ILD component and affects 10% of patients and maybe more, and reduces life expectancy in those patients. And here you can see in this very state-of-the-art review by Kevin Brown that when we have extra-articular disease in rheumatoid arthritis, we have much worse survival in those patients, in rheumatoid arthritis patients. And here by Park study, it is obvious that when we have RA-UIP patients, we have the same survival. This is not different with IPF-UIP patients, while in the other groups of rheumatoid or other CVDs with not UIP patients, the survival is much better. And here you can also see that UIP pattern on CT associates with poor prognosis always in rheumatoid lung, here and here. Here is another study that is comparing different components of rheumatoid arthritis. So, and you know that when we have rheumatoid arthritis, different components of lung are affected. So we can have bronchiolitis, bronchiectasis, organizing pneumonia, so different aspects are. So always UIP is the worst histology pattern in CT. So it is logical to compare and contrast IPF and rheumatoid lung. So that's why we have done that. As usual, interstitial pneumonia is the pattern in IPF, and it is the most frequent pattern in rheumatoid lung, in contrast with other CVDs, like, for example, NSIP in scleroderma lung. And what is the relation of IPF, for example, with smoking? We have shown some year before that smokers have a better, non-smokers have a better survival than ex and current smokers. So it is clear that smoking influences in a negative way survival in IPF. We are also have evaluated the emphysema in comparison in rheumatoid lung and IPF. Emphysema, why? Because it is a definite smoking damage issue. So we have found increased levels of emphysema in patients with IPF and in patients with rheumatoid lung, and this was associated always in CT study with lower packed year smoking histories in these patients. In comparison with control groups, they were healthy controls and COPD patients. And in both IPF and rheumatoid lung, fibrosis was also coarser in smokers than in non-smokers. And with this background, so we know that smoking also increases the incidence and the severity of rheumatoid arthritis, possibly by citrullination, and thus increases the risk of severe extra-articular RA manifestations. And here you can see the evidence that smoking in combination with genetic risk factors interact in providing an increased risk for rheumatoid arthritis. However, less is known about how smoking contributes to rheumatoid arthritis in the context of this genetic variability, and what proportion of rheumatoid arthritis may be caused by smoking. However, the citrullination pathway has to do with that. That's why we have chosen that, because smoking was estimated to be responsible for 35% of these ACPA-positive cases, and in individuals that carry 2 copies of these genes, 55% of ACPA-positive RA was attributed to smoking damage. However, the increased risk due to smoking is dependent on the amount of smoking and genotyping. And here you can see that the rheumatologists have done much more in this area, because they have found that ACPA-positive RA, that they have these 2 genes interactions and smoking. So the environmental insult plus the genetic background, they have high odds ratios in order to develop the disease. You see the difference. So it is not very clear if autoimmunity is involved in IPF pathogenesis, and I will show to you different studies later. However, we have explored whether an autoimmune process implicating this pathway, so the immunity pathway, could take place in these patients with IPF. So this was our hypothesis, that this pathway is implicated also in IPF. And what is the citrullination? Citrullination is the post-translation modification of arginine to bipeptide, but these PADI enzymes to arginine in citrulline, and this is not normal, but it occurs in rheumatoid lung. And this is the hypothesis that comes from Claresco's groups, and it seems that there is a very strong interaction between the lung, the bone marrow, and of course the synovium when we have the arthritis. So here it seems that their hypothesis is that smoking is activating these PAD enzymes, that they are responsible for the citrullination process, and then it is the first that it is event that is triggering this disease. So this is the first hit. And then we have the antigen presentation to HLA, the involvement, of course, of the genes, and they have done a lot in genes, because we have this HLA, DRBN, and the PTN-TN22, that they are very strong related genes to rheumatoid arthritis, the humoral and adaptive immunity, and the involvement of bone marrow. And then we need a second hit in order to have the arthritis, and then enough is involvement of the PAD enzymes in the citrullination process. So this is a virtuous cycle, and lung is mainly involvement in this process. So the aim of the study was to find the activation of the citrullination pathway in rheumatoid lung and IPF, and the linkage, if there is, between citrullination and outcome in both diseases. So we have evaluated the expression, the mRNA expression and the protein expression by Western blot analysis of 2 major PADI enzymes that they are catalyzing this process, and PADI2 and PADI4 in BAL of 53 patients with IPF, 37 patients with rheumatoid lung. Mainly they were patients with UIP in CT, and 10 healthy controls. And what we have found is that there were increased mRNA expression in PAD2 in IPF in comparison with controls, and the same in rheumatoid lung. Here is the protein expression that you can see better here, because with a Western blot analysis, it is obvious from the Western blot that the rheumatoid lung, of course, the expression of PAD2 was much higher than controls and IPF. But still, when we have compared IPF with controls, PAD2 protein expression was higher than controls. Here is the PAD4 mRNA expression. Still, you can see that the mRNA expression is much higher in IPF in comparison with controls, and this is statistically significant for rheumatoid lung. And here you can see the Western blot when PADI4 enzymes levels were higher in rheumatoid lung compared to the controls, as well as compared to the IPF, while PADI4 levels were higher in the IPF group compared to the control group, where you can see this is statistically significant. So you can see that it is evident the phenomenon of this expression in IPF. And when we have analyzed for survival, here you can see that 29 of 53 IPF patients died during a follow-up time of 35 plus to 28 months, and 16 out of 37 RA-ILD patients died during a follow-up time of 42 plus 26 months. And when we have compared the survival, there was not any statistically significant, so the population had the same, the two groups had the same survival. And when Professor Wells has analyzed against the outcome, we found that PADI4 levels were marginally predictive of mortality in IPF. You can see p-value, but where PADI4 levels were predictive of late mortality in IPF before and after adjustment for CPI, age, gender, and smoking. While PADI2 levels were not predictive of mortality in IPF, and this result was unchanged with adjustments for age, sex, and smoking status. PADI4 and in rheumatoid lungs were only marginally predictive of mortality, but this relationship became statistically significant with adjustment for age, sex, and smoking status and disease severity, and PADI4 levels were predictive of late mortality in rheumatoid lung before and after adjustment for CPI, age, gender, and smoking. And regarding rheumatoid lung and PADI4, where the PADI2 levels were marginally predictive of mortality in RA-ILD, and this relation was statistically significant with adjustment for age, sex, and smoking status and disease severity, and were also predictive for late mortality before and after of adjustment with CPI, age, gender, and smoking. We have combined the population because we have seen that both groups had the same survival. So a multivariate analysis with stepwise logistic regression identified 3 factors that independently predict mortality in the study population. So these factors were CPI, age, and both PADI2 and PADI4 levels. And when both PADI2 and PADI4 were included in the same analysis, both were independently predictive of late mortality after adjustment for disease severity, age, gender, and smoking status. And here I can show you some previous study that have, results that could explain our results, and investigating the role of autoimmunity in IPF or in IIPs. This is a small study, histology study, and here it is the first group that have shown that citrullination proteins could be detected in lung specimens of patients with RA-associated interstitial pneumonia, and in 9 patients with idiopathic interstitial pneumonia. But this was a small lung tissue study, and they didn't find any correlation with demographic data like age, gender, or smoking studies, or smoking status, or smoking. And here you can see another study from France that they have investigated whether the levels of anti-CCPs2 in patients with rheumatoid arthritis are associated with the occurrence of lung diseases. And they have found in a total of 252 RA patients that were included in a cross-sectional study that pulmonary disease was confirmed by high-resolution by CT study, and the circulating anti-CCP levels were quantified by ELISA, and they have interestingly found that male sex and high anti-CCP levels were identified as independent risk factors for lung disease in rheumatoid arthritis population. So you can see this interaction. So the high levels of ACPA in lung disease and when we have lung disease and when we don't have. And here is one more study than Professor Crestani's group, a very elegant study that demonstrates for the first time the presence of circulating anti-periplakin antibodies in the serum of patients with IPF, and the antibodies were also detected in BAL and were associated with a more severe disease. They couldn't find a correlation with survival. This periplakin is very strongly expressed in the alveolar epithelium in the fibrotic lung, and they hopefully have an ELISA in order to further investigate this phenomenon. And this is from Araya Fisher recent study in respiratory medicine that they have to characterize a novel cohort of patients with lung disease, and they have measured anti-CCP antibodies positivity, and these patients were patients without rheumatoid arthritis or other CTD, and they have found that the majority of subjects were women, and most they were former cigarette smokers, and they have found that those patients have distinct radiologic phenotypes like airway disease, and this is an interesting study, or isolated interstitial lung disease in 14%, and other subgroups, and even the combined pulmonary emphysema, fibrosis, and emphysema, they have found these anti-CCP antibodies without a specific rheumatoid arthritis or connective tissue disorder. So we suggest that citrullination is an active process in both autoimmune and idiopathic lung fibrosis, and the role of citrullination enzymes as biomarkers that predicting late mortality merits further investigation. Thank you so much for this.
Any questions? I don't hear that. It's not on.
Excuse me.
Turn on them. Speak up.
Yes. I am wondering if your controls were smokers in a similar way or time that the IPF or arthritic rheumatoid patients?
Yes, they were smokers, the healthy controls.
Heavy control, yes.
Yes, they were smokers. The majority of them, 8 of them, were smokers with a similar pack-year history with IPF and rheumatoid lung. And I didn't show, but we found an interesting correlation. So the mRNA PADI4 enzyme was much more higher in smokers in the combined population than non-smokers regarding this expression. But
and do you know, I don't know, do you know if this study has been done in COPD patients?
no, they haven't done that in COPD. But it is an interesting, something that maybe we have to do, because there is this kind of combined emphysema pulmonary fibrosis syndrome. We have sometimes this component to have these disorders together, and maybe we have to analyze them or to compare them too. But we haven't done that.
Okay, well, thank you. Very nice.